Hi, Kaylin. I'm Dr. Malloy. I'm a nurse practitioner, and today we're going to conduct an assessment of your head, eyes, ears, nose, mouth, and throat. So, to begin, I am looking at your head, and it appears normal cephalic. I don't see any obvious infestations or nits in your hair, and you appear well groomed. So, I'm going to start by palpating your head. Does anything hurt?
No.
And I'm now checking your scalp for any lesions. And I'm also noting the distribution of the hair. I don't see any patches of hair loss. And your hair is shiny and smooth, and I don't see any flaking of the scalp. Now I'm going to palpate your temporal artery for elasticity and your temporomandibular joint for mobility. If you can open and close and move your mouth side to side or jaw side to side, good. Now I'm going to assess for sensation and let me know what you feel. This is going to be soft and this is going to be sharp. Close your eyes. Let me know what you feel.
Sharp, sharp, soft, sharp.
Very good. This time I'm going to assess for cranial nerve 7, which is the facial nerve. So you can open your eyes now. If you can raise your eyebrows, frown, close your eyes real tight, clench your teeth, and puff out your cheeks. Very good. Now we're moving on to the eyes. So first I'm going to have you stand, and if you can read our Snellen chart, first cover your left eye and read the lowest line that you're able to read.
DEFPOTEC.
And cover your right eye this time and read the lowest line that you're able to.
DEFPTOC.
And with both eyes uncovered, read the lowest line that you're able to.
DEFPOTEC.
And your visual acuity is 20/20. Have a seat. Now I'm going to assess your near vision, and I'm putting this 14 inches away. So normally I'll have you cover your left eye and then cover the right eye. But for the purpose of this demonstration, I'm just going to have you read with both eyes uncovered the lowest that you are able to see.
LTFPH.
And again, you have 14/14 for visual acuity, which is normal. Now I am going to assess your extraocular function. So first, I'm going to have you cover one eye. And I'm noting the reaction of the opposite eye. And if you can uncover, I'm also noting that the left eye is steady, so both eyes are without nystagmus or lid lag or involuntary movement. Next, I'm just going to assess your corneal light reflex, so just look behind my shoulder. And the light reflex is symmetric. Next, I'm going to assess for extraocular movement. So if you can track the movement of my finger without moving your head. And extraocular movement is intact. Next, I'm going to assess for peripheral fields. So if you can cover one eye, cover your left eye, and I'm going to cover my right eye. Let me know when you see my finger.
Now, 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 now.
And your peripheral fields is intact. Now I'm going to inspect your eye. So if you can look up for me, look down. Your conjunctiva is clear, your cornea is shiny, and your sclera is anicteric. I don't see any swelling or crusting in your lids. Now I'm going to assess for pupillary reaction. So first for direct reaction, and you can just look behind my shoulder, and the left eye react, the left eye pupillary reaction is intact. I'm just going to repeat the motion, and the right eye is also reactive. And I'm going to do the same on the other side. I'm going to test for accommodation. So if you can just follow this ophthalmoscope, I'm going to bring this closer to your field of gaze. And the eyeballs converge. So your pupils are equal, they're round, reactive to light, and they accommodate. Next, I'm going to perform a fundoscopic exam. So I am going to approach at an angle, and normally we'll have the light off, and that way you can identify the red reflex easily. But for the purpose of this demonstration, we'll keep the light on. So I'm going to use my right eye to examine your right eye. So once I've identified the red reflex, I'm going to work my way closer to you. Here you go. And I'm noting the general background, the retina, the vessels, the optic disc, as well as the macula. Okay. After the eyes, we're going to next assess your ears. So I'm just going to switch this around. So I'm going to inspect your ears, noting for any changes in skin color, for any swelling. And does this hurt?
No.
What about this one?
No.
Okay. And nothing hurts while I'm palpating your ear. Now I'm going to just look at the inside of your ear, assessing your tympanic membrane and the cone of light. I'm going to pull your pinna up and back. And your tympanic membrane is pearly gray. The cone of light is not displaced. I don't see any lesions or excessive cerumen buildup. Next, I'm going to perform the whisper test. So if you can cover one ear, I'm going to whisper something and just tell me what it is you hear.
Popcorn. Apple.
And I will do the same on the opposite ear. If I had any concerns about hearing, I will also perform the Weber and the Rhine test. So for the Weber, I'm going to put my tuning fork on top of your head and let me know whether you hear the vibrations equally or only on one side. Do you hear it equally?
Yes.
For the Rhine, I'm going to put this behind your ear at the mastoid process. Once you stop hearing it, raise your hand and I'm going to reposition it next to your ear. Do you still hear it?
Yes.
Okay, very good. So after the exam of the ear, we're moving on to the nose. So if you can close your eyes, I'm going to have you identify an odor. Let me know what it is you smell.
Lemon.
And it is lemon. You can open your eyes now, and if you can cover one nair at a time and breathe in and out. And the other side. Next, I'm just going to look inside your nair. Okay, so I'm looking at the nasal mucosa. I'm inspecting the turbinates as well as the septum. I don't see any perforation or deviation, and I don't see any discharge or crusting. Next, we're going to move on with an examination of your sinuses. So let me know whether this maneuver hurts. So first, the frontal sinuses. Does that hurt?
No.
And the maxillary sinuses. Does that hurt?
No.
Now we're going to move on to the mouth. So I'm just going to put my gloves on. And I'm just going to grab a tongue depressor and my light here. So I'm looking at your lips. They're moist. I don't see any lesions. And if you can open your mouth, I'm assessing your teeth and they look to be in good repair. I'm looking at your gums and I don't see any swelling. If you can just lift your tongue up so I can look at the floor of the mouth, of the tongue. And if you can stick out your tongue is moist and midline. I don't see any lesions. And if you can say ah, the uvula rises midline, the palate is pink without crusting lesions, the tonsils is 1 plus, and the oropharynx is pink without exudates. Now I'm going to assess your lymph nodes. So this is going to be the preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and the supraclavicular. And your lymph nodes are non-tender. Next, I'm just going to have you sip from the cup and noting your swallowing. Very good. And I'm just going to palpate your trachea and your thyroid gland. So first the trachea at the notch. And if you can bend your head forward and to the side, I'm going to palpate your thyroid gland. The opposite side. Okay. And your thyroid gland is non-palpable. If it was enlarged, I would also auscultate it for bruit. Next, I'm going to just assess your range of motion in the neck. So if you can bend forward, bend your head forward, backward, look to the left, to the right, and touch your left ear with your left shoulder and the right ear with the right shoulder. Now I am just going to auscultate your carotid. And I'm also going to palpate. And I'm doing this one side at a time. And I'm also inspecting your neck, and I don't see any obvious masses or lesions. I don't see any changes in your skin, and it's pretty much consistent throughout. So that concludes our head, eye, ear, nose, mouth, and throat exam. Do you have any questions for me?
No.
Thank you, Kaylin.